Hey, I'm Brooke Pridmore with Bevel and gonna start the medication administration. Okay. The first part, I'm going to identify the intradermal, which will be this forearm area. And this is where you give the intradermal injections. Then I'm going to do the deltoid, which is going to be the triangle area here, and administer here. Then the ventrogluteus, which is in the hip area, in this area right here. And then the vastus lateralis, which is going to be in the side part of the leg here. Okay, so I have my doctor's orders. I'm going to check the patient's name, if they have any allergies, and they don't. And then I'm going to look at the medication. I'm going to perform hand hygiene. And then I'm going to go ahead and get all of my stuff together. So I'm going to get my TB needle, because she needs TB test, and then my TB skin test here. I'm going to get my insulin syringe and my 2 insulin medications. And then I'm going to get my 3mm syringe and my antibiotic, which is Rocephin, 500 milligrams. I'm going to check the date on the Rocephin. It expires October 1st of 2020. Insulin regular is February of 2028. NPH insulin is February of 2029. And then the TB is February of 2028. Going to get my alcohol prep pads, my bags and labels so I can label my bags, and then Band-Aids for whenever we go into the patient's room. Okay, I will hand hygiene and put gloves on. I'll take an alcohol swab, and I'm going to draw up the TB skin test first. I will clean it vigorously. Throw that away. And then I'm going to be pulling up .1. So I will take my medicine container out. Oh yeah, that's right. I've got to do the 6 rights. Make sure that my paperwork matches, the patient's name matches the medication that I'm going to be drawing up. Make sure they have no allergies. That the drug's in date. I think that's all. And then I'll be doing it in the right route. The right dose. So I'll have to pull up the right dose, which is 0.1 milliliter. So I'm going to take this off, stick it into my medicine vial. I'm going to pull 1 or 0.1 milliliters of air. I'm going to inject the air before I pull. I'm going to turn this up and pull slowly with no air bubbles. 1 milliliter, which I got an air bubble. Let me get that air bubble out. I'm gonna tap to get the air bubble to the top. Now I've got enough in there that I can push some out to get the air bubble gone, okay? So now I'm gonna show you that it's at 0.01 and that it's the correct dose. And then I'm going to recap. And then put it in my labeled bag. Okay, and I'm going to set that to the side. And then I'm going to go to my insulin. I'm going to, with the insulin NPH, I'm going to shake it back up without shaking vigorously. I'm going to do this little praying hands thing until all the powder is mixed up. Okay, all the powder is mixed up clearly. And then I have my insulin NPH and my insulin regular. I'm gonna clean the pH top, vigorously clean it with the alcohol swab. I'm gonna discard it. Open a new alcohol swab. Clean the insulin regular. Discard it. I'm going to get my insulin injection, and I would be doing 10 for the insulin pH and 5 units for the insulin regular. So I'm going to do 10 milliliters of air, which is right there. That's the 10 millimeters. And I'm going to put the air into the insulin NPH. Okay. Then I'm going to draw up 5 units, which is right there. And this is just air into the insulin regular. And then after I've pushed in the 5 units into the insulin regular, I'm going to pull 5 units slowly so I get no air into it. There's an air bubble. Okay. So I've got the 5 units of insulin regular. There's a little air bubble. Dang, come on. Okay. So there's the 5 units of the insulin regular. And now I can give the 10 units of the insulin pH, which I've already put the air in. So that'll end up calculating to be 15 units altogether. So I stick this in and pull up slowly to have no air bubbles in it. Okay. Okay. And then you can see the 15 units. Okay. And then I have my thing in here. So I'm going to, come on, set it right. Okay. Got my cap back on. And then I have my bag labeled insulin. So it is labeled and ready. Okay. Then I'm going to take my Rocephin 500 milligrams. I'm going to clean it vigorously with the alcohol swab. I have my filtered needle to be able to withdraw. Oh, my nose. And I'm going to be given 500 milligrams. So it's 500 milligrams per milliliter. So it's going to be 1 milliliter that I'm going to withdraw. I'm going to take the cap off. Oh, nope, hold on. I almost messed up, but I didn't. I'm going to draw up 1 milliliter of air. Going to dang that thing. Okay, push the air. I'm going to turn it up. I'm going to withdraw 1 milliliter. Got a bubble, hold on. Okay. Let me get this bubble out. There it goes. And then I'm going to plunge it, okay? So if you can see that it's at the 1 milliliter mark. Okay. Then I'm going to put the needle back into this. I'm going to take this cap off and put this into my sharps container. And then I'm going to open up and put the regular needle on, so it's ready to go. And it's in the bag and it's ready. Okay, I'm going to then remove my gloves, discard of them, hand hygiene. Okay, now I will be going to my patient's room I'm gonna knock. Come in. My name is Brooke. I'm gonna be your nurse today, and the doctor's ordered for me to give you some insulin NPH, insulin regular, Rocephin, which is an antibiotic, and do a TB skin test on you today. Is that okay? Okay. The patient agrees. Can I get your name and date of birth? Mr. Doe, okay, and your date of birth? Okay. That looks correct on here. I have my supplies here with me. I have all of the supplies that I need. My sharps container. Okay. So I'm going to set my order down. I'm going to hand hygiene. I'm going to ask the patient, do you have any allergies? No? Okay. I'm going to look and make sure, because I'm going to start out with giving the TB skin test. I'm going to make sure that my paper matches my paper that I have. That was the insulin first. I'm sorry. We do the insulin first. But I'm going to make sure that the insulin matches my doctor's orders, and it does. Make sure that it's for the correct patient. It is. And I'm going to give the patient their rights to, is it okay if I administer the insulin to you? Okay, it's fine, all right. And you're not allergic. Now this drug is to help bring your sugar down. And okay, so we're gonna go ahead and get ready. Okay, so it's gonna be It's going to be 10 units of the NPH and 5 units of the regular, which is all together. I'm going to get my needle out. Going to get my supplies ready. Okay. I'm going to prep the area, and I'm going to be giving this in the abdominal area and sub-Q. Okay, once it's dried, I'm going to, it's 15 milliliters, or 15 units, and this is 15 units. Okay, so I'm going to take the top off. Then I'm going to hold the skin tight and straight in. And then I'm going to hold it and push with my dominant hand to make sure that the needle does not move from the skin. Now I'm going to slowly inject the medications. Okay. Remove it quickly. Then I'm going to discard into my sharps container. Going to put a bandage over the area. Okay, then I'm done with that one. Then I'm going to go to the Rocephin. Okay, going to make sure that it all matches up with the name, date of birth of the patient. Make sure they have no allergies to it, and they have none. Is it okay if I give you this Rocephin antibiotic shot? It is? Okay. Okay, so I'm done with that one. Then I'm going to go to the Rocephin. Okay, going to make sure that it all matches up with the name, date of birth of the patient. Make sure they have no allergies to it, and they have none. Is it okay if I give you this Rocephin antibiotic shot? It is? Okay. Is it okay if I give you this Rocephin antibiotic shot? It is? Okay. I'm going to look and see where I'm going to give this to him. So I'm going to be giving this to you in the right deltoid. Okay. So I'm going to get the medicine out of the thing. Make sure that it's 1 unit or 1 milliliter, 1 milliliter. Okay. I'm going to make sure that this is given at the right time, which is at 9 o'clock. It's 9 o'clock. Okay, I'm going to make sure that the patient's okay with it. They are. Okay. So I'm going to get an alcohol, prep the area. Get the syringe ready. Since it's already got the brand new top on, I'm going to take the top off. I'm going to hold the skin tight. I'm going to go in at a 90-degree angle. Then I'm going to hold it with my left hand and use my dominant hand to slowly administer the medication. Okay, I'm going to leave that in there for about 10 seconds. And then I'm going to pull it out quickly. Do the safety thing. Put it in the sharps container. Put a Band-Aid on the area. Okay, then I'm going to move on to the TB skin test. I'm going to get my patient's arm. I'm going to get the medications. Make sure that it's the correct dose. I'm going to be giving the patient the correct dose, okay? 0.1 mil, 0.1 mil. Okay, it is for the forearm, which is this area here. It is to be administered at 9 o'clock, and it is 9 o'clock. Okay, I'm going to ask the patient if it's okay if I give them the medications. It's fine. I'm going to check their allergies. I'm going to check their name, date of birth. I'm going to make sure everything is correct before administering the medications. Okay. And then I'm going to explain to them that this is going to cause a little well of a little bump. This is a intradermal. So it's just going to be right up underneath the skin. And then we'll come back in 48 to 72 hours to read this reading, which would be, today's date is April the 17th. And it is 9 a.m. So they could come back it's April. They could come back April the 18th at 9 a.m. No, April the 19th at 9 a.m. for me to reread the area, because it's 48 to 72 hours. Okay. I'm going to get the alcohol area. I'm going to prep my hot dog. Throw that away. Okay. I'm going to take the top off the needle. I'm going to show bevel up. I don't know if the camera will focus on that, but okay. So it's going to be bevel up. I'm going to go in from a 5 to 15 degree angle. 1, 2, stick. Okay. I'm going to slowly inject. Then I'm going to pull out. I'm going to disregard. There's the whale. It's leaking out. Okay. Then I'm going to, if it's bleeding or anything, I can put, I'm going to have a piece of gauze, and if it's bleeding, they can wipe the blood, but barely touch it to get soak the blood up, so it's not, because you can't pat it or rub it or anything in that area. Okay, then I'm going to take my gloves off. I'm going to hand hygiene. Okay, then I'm going to chart. I'm going to chart that the insulin NPH and insulin regular was administered in the abdomen sub-Q at 8 a.m. I'm going to say that, or I'm going to document that the Rocephin 500 milligrams IM was administered at 9 o'clock in the right deltoid. Tolerated well, no adverse side effects. I'm going to document that I administered the TB skin test, 0.1 milliliters by 1 dose, and it'll be read in 48 hours. I administered it on April the 17th at 9 o'clock a.m. in the left under forearm area, and it was tolerated well with no adverse side effects. And that's it. Thank you.